Did you know that lichen sclerosus is a common skin condition that affects about 1 in every 100 women, but is often underdiagnosed and misunderstood? Have you ever heard of lichen sclerosus, a chronic inflammatory skin disorder that can cause severe itching, pain, and scarring in the genital and anal areas? What if I told you that there is a condition that can make your skin thin, white, and wrinkled, and that it can affect your sexual and urinary health, as well as your risk of skin cancer? Welcome back to our channel. In this video, we will explore what lichen sclerosus is, what causes it, what are its symptoms and complications, and how it can be managed and treated. Causes of lichen sclerosus. The exact cause of lichen sclerosus is not fully understood, but it is likely a combination of genetic, hormonal, immune, and environmental factors. Lichen sclerosus is often classified as an autoimmune disease, meaning that the body's immune system mistakenly attacks its own healthy tissues. This may be triggered by infections, injuries, or hormonal changes. Lichen sclerosus is more common in women than in men, and especially in postmenopausal women, suggesting that a lack of estrogen may play a role. It is also more common in people who have other autoimmune diseases, such as thyroid disease, pernicious anemia, or alopecia areata. Lichen sclerosus is not contagious and cannot be spread through sexual contact. It is also not caused by poor hygiene, sexual abuse, or sexually transmitted infections. According to the Mayo Clinic, lichen sclerosus is a condition that causes patchy, discolored, thin skin. A study published in the Journal of the American Academy of Dermatology found that antibodies to a specific protein called extracellular matrix protein 1 ecom1 were detected in 60–80% of women with vulvar lichen sclerosus. A review article in the British Journal of Dermatology reported that lichen sclerosus affects about 1.7% of women and 0.7% of men, and that the incidence increases with age. Symptoms of lichen sclerosus. Lichen sclerosus mainly affects the skin of the genital and anal areas, but it can also affect other parts of the body, such as the back, shoulders, upper arms, and breasts. The affected skin may appear as white, smooth, or thickened patches that are usually thinner than normal skin. The patches may be blotchy, wrinkled, or shiny, and may have cracks, fissures, or blisters. The most common symptom of lichen sclerosus is itching, which can be mild to severe and may interfere with daily activities and sleep. The itching may also lead to scratching, which can cause bleeding, bruising, or infections. Other symptoms of lichen sclerosus may include pain, soreness, burning, or stinging, especially when urinating or having sexual intercourse. The skin may also become fragile and prone to tearing or ulceration, which can increase the risk of scarring and narrowing of the openings of the vagina, anus, or urethra. Complications of lichen sclerosus. Lichen sclerosus can have a significant impact on the quality of life of the affected individuals, affecting their physical, emotional, and sexual well-being. Lichen sclerosus can cause scarring and adhesions of the skin, which can lead to deformity, loss of function, or obstruction of the genital or anal areas. For example, women may experience fusion of the labia, covering of the clitoris, or narrowing of the vaginal entrance, which can make sexual intercourse difficult or impossible. Men may experience phimosis, which is the inability to retract the foreskin, or meatal stenosis, which is the narrowing of the urethral opening, which can affect urination and ejaculation. Lichen sclerosus can also increase the risk of developing skin cancer, especially squamous cell carcinoma, which is a type of cancer that arises from the outer layer of the skin. The risk of skin cancer is estimated to be about 4–5% for women and 2–3% for men with lichen sclerosus. Therefore, regular skin examinations and biopsies are recommended to detect any suspicious changes or lesions. Diagnosis of lichen sclerosus. Lichen sclerosus is diagnosed by a doctor, usually a dermatologist or a gynecologist, who specializes in the study of the skin and its disorders. The diagnosis is based on the history, symptoms, and physical examination of the affected skin. Sometimes, a skin biopsy may be performed to confirm the diagnosis and to rule out other conditions that may have similar features, such as lichen planus, psoriasis, vitiligo, or skin cancer. A skin biopsy is a procedure where a small piece of skin is taken and examined under a microscope. Treatment for lichen sclerosus. There is no cure for lichen sclerosus, but there are treatments that can help control the symptoms, prevent complications, and improve the appearance of the skin. The main treatment for lichen sclerosus is topical corticosteroids, which are creams or ointments that reduce inflammation, itching, and scarring. They are usually applied once or twice a day for several weeks, then reduced to a maintenance dose of once or twice a week. The strength and duration of the treatment may vary depending on the severity and location of the condition. Some examples of topical corticosteroids are betamethasone, clopidogrel, and mometasone. Other treatments that may be used for lichen sclerosus include topical immunomodulators, which are creams or ointments that modulate the immune response and prevent flare-ups. They are usually used as an alternative or an adjunct to topical corticosteroids, especially for long-term use or for sensitive areas. Some examples of topical immunomodulators are pimecrolimus and tacrolimus. In some cases, other treatments may be considered, such as ultraviolet light therapy, which uses artificial or natural light to slow down the growth of the affected skin cells, oral medications such as retinoids, methotrexate, or hydroxychloroquine, which affect the skin cell turnover or the immune system, or surgery, which may be done to remove scarred or cancerous tissue, or to improve the function or appearance of the genital or anal areas. However, these treatments are not routinely used and may have more side effects or risks than the topical treatments. Tips to manage the lichen sclerosus. Follow the instructions of your doctor on how to use the prescribed treatments and report any side effects or concerns you may have. Do not stop or change the treatment without consulting your doctor, as this may worsen the condition or cause a rebound effect. Apply the treatments gently and sparingly to the affected areas and avoid rubbing or scratching the skin. Wash your hands before and after applying the treatments and avoid contact with your eyes or mouth. Use mild, fragrance-free, and hypoallergenic products for your personal hygiene, such as soap, shampoo, lotion, and laundry detergent. Avoid using products that may irritate or dry out your skin, such as alcohol, astringents, or perfumes. Wear loose, comfortable, and breathable clothing and underwear, preferably made of cotton or natural fibers. Avoid wearing tight, synthetic, or rough fabrics that may cause friction or sweating. Protect your skin from sun exposure, as this may worsen the condition or increase the risk of skin cancer. Use a broad-spectrum sunscreen with a sun protection factor SPF of at least 30 and wear a hat, sunglasses, and protective clothing when outdoors. Maintain a healthy lifestyle, such as eating a balanced diet, drinking plenty of water, exercising. Importance of seeking and receiving support for lichen sclerosus. Lichen sclerosus can be a challenging and isolating condition, affecting not only your physical health, but also your mental and emotional health. You may experience feelings of anxiety, depression, anger, frustration, shame, guilt, or low self-esteem. You may also face difficulties in your relationships, intimacy, or social life. Therefore, it is vital to seek and receive support for lichen sclerosus, both from professional and personal sources. Support can help you cope with the condition, improve your quality of life, and prevent or reduce the negative impacts of lichen sclerosus on your well-being. Support can come in various forms, such as medical support. This includes your doctor, nurse, pharmacist, or other healthcare providers who can offer you diagnosis, treatment, follow-up, and education on lichen sclerosus. They can also refer you to other specialists or services that may be helpful, such as a dermatologist, a gynecologist, a urologist, a psychologist, a sex therapist, a physiotherapist, or a pain clinic. Psychological support. This includes a counselor, a therapist, a psychologist, or a psychiatrist who can provide you with counseling, therapy, or medication to address any mental or emotional issues that may arise from lichen sclerosus. They can help you deal with stress, anxiety, depression, trauma, or other psychological problems that may affect your mood, thoughts, or behavior. Peer support. This includes other people who have lichen sclerosus or similar conditions who can share their experiences, insights, tips, or resources with you. They can offer you empathy, understanding, encouragement, or advice. You can connect with them through online forums, social media groups, blogs, podcasts, or support groups. Family and friend support. This includes your loved ones, such as your partner, spouse, children, parents, siblings, relatives, or friends, who can provide you with emotional, practical, or financial support. They can listen to you, comfort you, help you, or accompany you. They can also learn more about lichen sclerosus and how to support you better. Lichen sclerosus is a condition that can be challenging and isolating, but it is not a life-threatening or hopeless condition. With proper diagnosis, treatment, management, and support, you can live a fulfilling and satisfying life with lichen sclerosus. You are not alone in your journey with lichen sclerosus. There are many people who understand what you are going through and who can help you cope and thrive. You are also a valuable and unique person who has more to offer than your skin condition. You deserve respect, compassion, and happiness, no matter what. Thank you for watching the video. We hope that you have found it informative, accessible, and supportive. Like and subscribe to our channel. If you have any questions, comments, or feedback, please feel free to comment in the video. We wish you all the best and hope that you stay healthy and well.